Good afternoon. Well, actually, good morning. I'm sorry. Good morning. I'm getting it all mixed up. Good morning and welcome to this session as we discuss Georgia's system of care and how local coordination and family engagement are making a difference. So, we're so glad that you all have joined this session. As you come in, please do go into the chat, which is located on the right side of your screen, and just let us know where you're joining from. Anything you want us to know, anything you want, an emoji, it doesn't matter. We just want to feel some energy this morning. We're so excited to have you. We'll give folks just another minute to gather, and we will get started. We see the beautiful state of Maine. Good morning from Indiana. Good morning. Good morning. Good morning, Austin, Texas. Yes, Milwaukee. Love it. Good morning. Good morning, Georgia. Pennsylvania, Oklahoma. Glad to see you. Glad to have you in the room. Good morning. Good morning. All right. So we want to make sure that we get the most out of our time together. So I am going to do just a bit of housekeeping, and then I'm going to hand it over to our phenomenal speakers to dig into the content for today. And so I want to welcome everyone again to this session. We're glad that you have chose to join us. Just a few things that I want to put before you. We'd like to remind everyone of our commitment to maintaining, a safe and accountable space. If you experience issues and need assistance, please do reach out to me. Again, I'm Dr. Gia Kelly, and I'm one of the directors at Intact. And so you can send me a message, a direct message, if you have any issues or need assistance. And you can send that direct message by going to the top right corner of the event. Uh, Also, to walk you through the tools in this session, I want you to please again take a look at the vertical bar on the right side of your screen, and there are several icons in that vertical bar. If your event feed is open, it's going to be hiding your vertical bar. So please close your event feed by clicking on the X in the upper right corner of the event feed box. All right. So once you have closed your event feed, you'll be able to see that bar and those icons. You'll see a speech square, and that's the chat box for this session. You'll also see a Q&A icon right under that. And I'm going to ask you, if you have questions for the speakers, please put your questions in the Q&A, right? That is where we'll be looking for questions, not in the chat. We want you to utilize the chat if you're feeling what is being said, if something is an aha, if you are, enjoying the session, please do fill that chat up with your gifts and your emojis. But if you have a question that you want answered, please put it in the Q&A. Also, there's an icon of people indicating the participants in this session. And lastly, you'll see two papers stacked on top of each other, and that is where the resources are for this session. To enable us to keep up with the questions, again, only use the Q&A icon to share your questions. The speakers will pause periodically and take a few questions, and those questions will be broadcast on the screen for everyone to see. If at any time during the session you need to step away or take a break, debrief or decompress, please feel free to do so. Our wellness room is open, and you may enter the wellness room by clicking the wellness room button on the top left side of the event navigation bar, and a member of our team will meet you there. All right, enough from me. So now I'm going to introduce our phenomenal speakers for today. So our first speaker is Lakedra Mitchell. Lakedra Mitchell is a senior research associate with the Center of Excellence for Children's Behavioral Health within the Georgia Health Policy Center at Georgia State University. She was first introduced to system of care working in New Orleans across 5 parishes following Hurricane Katrina. She currently works on the MindWorks Georgia, which is Georgia's system of care team, to lead and support the assessment, development, and implementation of strategies and best practices to support children's behavioral health. And she also facilitates statewide system of care efforts. So we want to welcome Lakedra. Then our second speaker or presenter for today is Bonnie Ray. And I will move out of the way in just a moment and you'll be able to see their videos. Bonnie Ray is a certified peer specialist, a parent who is a strong advocate for family engagement and involvement in mental and behavioral health service delivery and coordination. She also actively advocates, for the continued expansion of peer support in Georgia. And then last but not least, we have Tandy Harris. Tandy is a mother and the parent and youth peer specialist coordinator at the Department of Behavioral Health and Developmental Disabilities, where she works in the Office of Children, Young Adults and Families, and the Office of Recovery Transformation. So without further ado, I'm going to hand it over to our presenters today for our session.
Thank you so much, Dr. Kelly, for that wonderful introduction. Thank you all for joining our session today. As she stated, I'm Lakedra, and I'm joined by my colleagues, Bonnie and Tandy Way, and we're excited to have you today. We're just going to be sharing a little bit about what's going on in Georgia with system of care, and we're looking at local coordination and family engagement and how they're making a difference in our state. And while we're talking about Georgia, we also, I saw a little bit in the chat that we have folks from all over. So we're very curious and interested to hear and have you share about what's going on in your communities too, because I'm looking at this as a peer learning opportunity. We don't have all the answers, but I think as much as we can share, we'll get a little bit closer to it. So just to kind of briefly go over our objectives for today, we hope that after this session, you'll be able to discuss local service coordination through a practice approach, services and supports, and look at how peer support initiatives are continuing to grow. Also describe the current strategies and infrastructure, future activities, and the lessons we've learned in our system of care in Georgia. And lastly, engage in a structured group discussion about children's behavioral health in your community and how we can continue advancing collaboration. As soon as I get my slides together. And I'd be remiss if I didn't say or state how we came to this meeting through our partnership with the Department of Behavioral Health and Developmental Disabilities. The Center of Excellence at Georgia Health Policy Center is able to carry out the system of care work, providing technical assistance, research and evaluation, backbone support, what have you. But I wanted to definitely acknowledge the partners that made this possible. So to kind of get into our workshop today, how we designed this is I really wanted to kind of give a little bit of background and framework to our system, specifically our local interagency committees, and then we will segue into our great peer support network that we have grown and are growing in Georgia. So again, to give that foundation, I wanted to identify some of the building blocks of our system of care in Georgia, starting with legislation. I think one great thing that we do have in Georgia, not saying that's the end all be all, but having legislation in place that supports our system of care has been helpful in some capacity in growing the work that we do. So having legislation that one establishes that there will be a system of care in Georgia that will have a commissioner level council that supports behavioral health services for adults and children, and legislation that supports our local interagency committees, which is what we're going to talk about specifically today. So those are that's one part of our building blocks. In addition to grant funding, we've had a variety of grant funding that has helped to support and sustain the system of care, from SAMHSA funds to CASP funds, which is Child and Adolescent Service Support Programs, capacity building grants, big grants, small grants. We've really had a diverse amount of funding that's helped to support building the system of care of Georgia and continuing to build it. We recently have gotten additional funding to continue to expand the work. So those have definitely been building blocks. But what I want to focus on, which I think aside from the money and legislation is really the foundation of a system of care, but especially in Georgia, is having those meaningful partnerships across agencies, having that multi-agency, multi-sector partnership with families and youth. And I know this is a more standard image of family, but we know families can look very different. But this is what our clip art showed. But that is a representation of our families and youth, and showing the partnerships across agencies with families and youth. So those are our building blocks that I did want to kind of lay out as the foundation for our system of care. And to get a little bit more detailed, I won't go over this too much, but looking at our infrastructure, and we're actually doing some rebranding. And if we come back here next year, if we're selected, or if we are presenting somewhere else, this will likely look different. But it really kind of gives a good foundation of our infrastructure in Georgia. I wanted to highlight that our local service coordination does not sit in a vacuum. It is not isolated. We are connected at the regional level, at the state level, with our state and commissioner leadership, and also at the government level. And those arrows represent that flow of communication. We really are intentional about making sure that what's happening in real time, boots on the ground, those that are doing the work, those are that receiving services, what is happening apart from what legislation might say or what policy might state, really stating what's happening in real time, so that those who are in leadership positions, decision makers, those that hold the money, can make informed decisions as we move through service delivery. So I wanted to highlight that as well. And so, getting into our local system of care in Georgia, they are known as Local Interagency Planning Teams, or some people say LIP teams, or LIPs, or as I say, LIPTs. And the purpose of LIPT is to improve and facilitate the local coordination of services to youth with or at risk for mental or behavioral health challenges. And I know that's a mouthful, but that's basically saying we have local county level teams of multi-sector partnerships at the local level that are committed to serving our youth and families who have mental behavioral challenges. And as I mentioned before, there's legislation that supports our system of care. And one of those pieces of legislation actually developed our LIPTs. Within that legislation, we have mandated agency partners, starting with DBHDD, the Department of Behavioral Health and Developmental Disabilities. That's probably the last time I'll say that. I'll just say DBHDD because that's a lot of words. But DBHDD in Georgia is our kind of oversight of system of care in Georgia, helping with the implementation of our statewide plan, providing a lot of the funding support, provider network, all those different things. So DBHDD is really, I say, the implementer of system of care in Georgia, but it does not, again, sit in a vacuum. We also have our Division of Family and Children's Services, which is our child welfare team, the local education agency or special education representative who sits on those teams. That's the Department of Education logo. The Department of Public Health, as we know, with the evolution of system of care, having that Public Health 3.0 approach, integrating physical health and mental health. So we have DPH at the table. Georgia Vocational Rehabilitation Agency, which I think I saw some folks in the chat representing Voc Rehab, which helps with job readiness, access to employment, and making those linkages for vocation and employment for those with mental or behavioral challenges. The Department of Juvenile Justice, which again, it's very self-explanatory, our juvenile justice system, and our local mental health agency, which in our capacity, when we say local mental health agency in Georgia, that's usually represented by our community service boards, which in your community may be the local mental health clinic or other community agency that provides mental health services. And I also like to point out that in the legislation, there's also language around ad hoc members. So while these are mandated agency partners, the legislation was smart to recognize that every county is very different and the needs are different. So there are many counties that also have what we call system of care coordinators, also through those community service boards that help with navigation and connection and access to services. Local community-based organizations, some teams might have big brother, big sister, who's a part of their care team, or they might have someone from law enforcement with their community team who's a part. So just really depending on who has been identified as that team and agreed upon as a resource to help connect families with services that they need. And the structure of LIPT, hopefully I'm painting a picture. And there are teams that may be single or multi-county. If you're not familiar with Georgia, which a lot of you probably are not, Georgia has 159 counties. I think we had the second highest number of counties in the country. So we have a lot of counties that range from urban, suburban, rural, very rural. It really runs the gamut. But the teams are single or multi-county, and those teams are designed just based on capacity of the team, geographic location, access, but really just unique to what their needs are. And these teams meet primarily monthly, some meet bi monthly, and some meet as needed. It's really a referral based. It's really dependent upon the strength of the referrals that come into those communities. But most teams do meet at least monthly or every other month. And in those meetings, there's a leadership structure that we recommend, but again, they're unique teams, so it might look a little bit different. But the recommended structure is having a chairperson, a co-chairperson, and a secretary recorder that helps document the information that's shared and discussed in the meetings. And one thing I think is very important to highlight and note is this is all volunteer led. Yes, we have legislation. Yes, we have these mandated partner agencies, but these are all volunteers that are doing this work, and they are amazing. I can't say enough about our chairs. We're always having discussions and looking at ways where we can support them through training, small incentives, ongoing technical assistance, what have you. But these are all volunteer led teams. So I wanted to highlight that as well. And so, how does LIPT work? I wanted to kind of simplify the process and kind of the structure of those meetings into 4 steps: a referral, a plan, support and engagement, and follow up. So anyone can refer to LIPT through the various networks, like I mentioned, those mandated partner agencies or folks who are outside of an agency. Families can self-refer. So anyone can make a referral to LIPT. In Georgia, those referrals primarily come from schools, child welfare, and juvenile justice. And once that referral is made, if the family accepts the meeting, because again, this is completely voluntary for the families to participate, a meeting is scheduled. Most times, meeting teams already have a set meeting date, and they work with the family to coordinate a time for them to come together and meet. During that meeting with those agency partners and the families making up that LIPT, the members with the families create care plans for youth who are at risk for or are diagnosed with a mental or behavioral health disorder. During COVID, we were definitely seeing more youth who are able to participate. But right now, most teams do meet during the time when kids will be in school. So oftentimes it's the families that are represented in those team meetings. But as much as possible, or when possible, we try to have youth also be able to participate in those meetings. And as far as the support and engagement, recommendations and linkages are made for the youth and families in the meeting. So referrals might be made for an updated individualized education plan, or it might be for a different type of therapy or some other type of intervention. Those are all recommendations that are made. The families do not have to choose to go along with that service, so they might have, okay, I've tried that service, I want to try something different. We really it's a really family driven and family youth driven process, so we really want to make sure that we're being directed and navigating in the direction the families want us to go. And with that, what I think sets LIPT apart is that there's that ongoing communication with family and there's accountability. There are different forms that are used in these meetings, and we're documenting the whole time um, what the referral and what recommendations are being made, in addition to following up. So we have 30, 60, 90, sometimes more follow up with the families, just depending on what the need is and how intense the services that are needed that are in place. So really having that accountability and circling back, not having that closed door approach to service delivery, because we know, everything doesn't work for everybody and it might not work for everybody at that time. So as you can imagine, sometimes there's a lot of recommendations and referrals made, and it might be overwhelming for family. That's where I want to highlight our system of care coordinators that we have um, in Georgia that can help in navigating some of those services. In addition, another referral might be to peer support, because that is a service that it has to be referred in Georgia. So making that connection for families as they're navigating services and being able to talk to someone else who has lived experience and kind of and may have walked the path or a similar path. And I wanted to, just again, talking about family engagement. Again, LIPT provides a family and youth driven and community based approach to service delivery. Speaking a little bit more about community based service delivery, historically, and I'm sure that has happened in other states, um, youth have not always been served in their community. We know there was a time, and in some instances, unfortunately, still a time where youth are shipped off or sent away when there's a challenge. LIPT is community based services. We want youth to be served in their natural environment, in their community as much as possible. Again, family input is critical to the process. We say nothing about us without us. So there should not be a meeting held without the family present. We're not, putting things in place and then bringing it to the family saying, okay, so this is what we agreed upon and here's what needs to be implemented. Everything is really holding hands in partnership with that family member. And in those meetings, I also wanted to highlight it's the youth and families' role to share relevant background information, express their goals and needs, and provide an understanding of what may be going on with the youth, because we know there's no better expert on what's going on in the household than those family members. And before I pause for questions, I also wanted to highlight some of our services that we're still expanding and evolving, starting with some of our relatively new in comparison service delivery models. With the Mental Health Parity Act that was passed a couple of years ago, we have now developed the multi-agency treatment for children's team in Georgia, or known as the MATCH team, which actually was a program that was in place decades before, or kind of preceded system of care as we know it today. With the Mental Health Parity Act, we have kind of redesigned and reimagined what that team looks like, and being a part of that strategic planning and seeing the different agencies come together and really look at kind of staff youth who are had those more complex and unmet treatment needs, such as mental health and substance use co-occurring disorders, and being able to kind of, I guess, refer up for those youth who might need services more intense than what can be provided locally. So that is still very much in development, but I will say, personally speaking, it feels very different looking at it now and seeing those agencies come together in real time and have raw, authentic discussions and not just finger point, because we know that happens among agencies. That's you should do that, but really have strengths-based approaches and conversations around how can we better serve families, how can we be solutions focused, how can we look at these barriers and actually say, okay, that's a barrier, let's fix that. So it's really exciting. So I'm happy to see how it's coming along and look forward to how it continues to progress. MC3, if you are familiar with high fidelity wraparound or intensive customized care coordination, we're now piloting and introducing MC3, or moderate customized care coordination, to help fill another service gap for those youth who may not necessarily meet the criteria of needing a more intensive service, but still might need some type of support and service. And Tandy Way, I don't know if you want to add a little bit more to that, because I know you're familiar with it as well. You're muted.
I apologize.
That's okay.
With MC3, it's what it says, moderate customized care coordination. So they may not be they aren't at the IC3 level yet, where there's a high intensity level of care needed. However, there are things going on, and so we want to catch it and get the services that are needed, to prevent going to higher levels of care.
Thank you. Yeah, I think when we discussed it, we talked about prevention and
Yes.
early intervention kind of wrapped into one. So
Yes. Perfect. Yes. Early intervention and prevention.
Yeah, we're so excited about that as well. And then just to speak a little bit very briefly around some other services and supports that we've had in place, our clubhouses, which is after school support for mental health, substance abuse, and behavioral health. And there are clubhouses that are specific to those different areas with trained staff to support youth who need additional support in those areas. Apex, which is our school-based mental health support, which helps bridge that gap, that access gap between services and being able to access the services. And what we're going to talk about for the duration of this workshop is peer support, which I hear that Georgia is, doing pretty well around peer support, but we're also curious to see what other states are doing and where you are in your development and what's going well. And I think I will pause for questions right now. Dr. Kelly, do you have any questions? Okay, I don't see Dr. Kelly, but I do see a question. Would you recommend or
Sorry,
suggest?
I'm sorry, there's a
Oh,
little delay. I'm sorry, it takes a minute,
okay, sorry about that.
but I'll read a couple. One of the questions says, would you recommend or suggest any youth peer-to-peer support curriculum? Do you all have any recommendations?
We're about to get more into the peer support, so I think we'll answer that question when we get into the next part. But that's a great question. Thank you for asking
Okay,
that.
so we'll pin that one. Thank you. And then the other question says, what's the most effective way to encourage and motivate parents and youth to become involved and provide their input or serve in the peer support capacity?
Um,
That's a great question. I'll hand it to y'all.
yeah, I want to make sure that I'm understanding it properly. How to grow the parent and youth CPS workforce? Is that what the question is, basically?
What's the most effective way to encourage and motivate parents and youth to get involved in that peer support work, basically?
Okay, great. So I would say the first thing which you want to let parents and youth know that they have a voice, and everything that they have experienced through their own journey has a can be used to support and help others. Um, I think that for me as a CPSP, and I don't want to get too much into that because we want to stay on track. I didn't know that peer support services were available for parents. I found out about that when I became employed. I actually qualified for the position, and then I found all about about it. And then it was it's been my career. I think to get parents and youth motivated about it and engaged in, to let them know that it's available, that everything that you have experienced is also an opportunity for employment for you, so that what you have experienced, what you have learned, can be used to help support someone else.
Mm,
Oftentimes people don't realize that, that, wow, I went through this. However, look what I'm able to do to support someone else, to convey hope, to let others know that their recovery is real. So I think just bringing knowledge and let them know that those opportunities are available are a good start.
thank you, Tandy Way, for that. And I'll ask just one more, present one more question. Cheryl asks, she says that Maine had formal local coordination committees and that their committees dissolved. Many communities have taken responsibility to meet needs of residents with informal collaboratives. Does Georgia have any of these groups? And if so, how do you incorporate these into your system of care?
That is a great question. We actually just we're still in the process of almost doing like a data gathering process, seeing what other multidisciplinary teams exist outside of our local interagency committees, because we do recognize that there's other work happening outside of just the LIPTs. We have children in need of services, we have school teams, we have community teams. So we're actually doing some information gathering around that now. In addition, with the Mental Health Parity Act that I just mentioned, through the match teams, one of the referral portals around the local community is, it's any local agency. It's not just the LIPTs. They're looking at LIPTs, but they're looking from, as stated, other informal collaboratives where youth might be seeking services or folks may be coming together to discuss service delivery. So those are some ways off the top of my head. But yeah, I think part of your question is also how we're expanding system of care in Georgia. And as I kind of mentioned earlier, we're looking at some rebranding and kind of reimagining how we can expand that work. Because I think, and this might happen in other states too, you find yourself preaching to the choir, even when you're like, okay, we're preaching to the choir. How do we, and you're still preaching to the choir, even after you have that conversation around preaching to the choir. So really looking at more innovative ways. And I know we've had some earlier presentation yesterday I sat in on, connecting with other groups who might have a connection to behavioral health or youth, that might not be under the system of care exactly, but connecting to universities and other partnerships. So it's a lot of different things that are going on. But that's a great question. Thank you for
Thank
it.
you for that. So we can hand it back over to you and we'll, hopefully get a chance to get some more questions in.
Okay. Thank you. Alrighty. And getting into peer support in Georgia. First, I'm going to give a little bit of background around our peer support system in Georgia, and then I will be handing over the reins to Bonnie and Tandiway. So I feel like the best way, and we discussed this, the best way to describe peer support in Georgia is to describe the role of a certified peer specialist or CPS. And I know in other, so a pause when we talk about language and using acronyms. Language is important because I know growing up or in other states, when you say CPS, that's Child Protective Services. So we're always very clear on the language that we're using and being able to describe acronyms, and describe this service. So that's another part in our system of care that we've been more intentional about the words that we use and how we use them in acronyms and all that. So that's my little soapbox for that. But a CPS is an individual who is trained and certified to provide ongoing support to individuals and their families that are also receiving mental health and or substance use recovery supports and services. To be a CPS, you must have lived experience. So that's a core eligibility of being a certified peer specialist, that lived experience and and finding that value in lived experience, as Tanway mentioned. In the role of a CPS, their role is to promote hope, personal responsibility, empowerment, education, and self determination in the communities where they serve. And that's just a little bit of a snapshot of their role, but we know that it's way more than that. In Georgia, certified peer specialist work is a Medicaid billable service, and these are the four areas that we're highlighting today. Well, we're highlighting two, but I wanted to mention our adult CPS mental health, which is adults 18 and up, also living with a mental health diagnosis, CPS AD for addictive disease. Again, adults 18 and up who are living in recovery from addiction and are abstaining from any drug use for over 2 years, who can support other adults. And where we're going to focus our conversation today, Youth Certified Peer Specialist or CPSY, which is a young adult aged 18 to 26, living with a behavioral health condition that's willing and able, who is willing and able to self-identify as a person who has or is receiving behavioral health services, that's prepared to use that experience to help others, other youth and young adults who are living with similar conditions. And in this capacity, I think CPSYs can actually serve up until the age of 30 in that role, even though the requirement is 18 to 26. CPSPs, we have two wonderful parent certified peer specialists that are with us today. In addition to probably in the audience, a parent or a legal guardian in a permanent relationship for at least 3 years of a child living with a mental health, substance use, or co-occurring diagnosis who provides support to other parents. And so how to access the peer support service. I wanted to be sure to state that anyone cannot just access peer support. It's like any other service that's referred or needed for a family. It has to be for a youth, well, for an individual living with a behavioral health condition and meets certain admissions criteria as determined by DBHDD. They must be receiving services from a DBHDD approved provider. Again, I said I wasn't going to say it again, but I'm going to say it one more time. Department of Behavioral Health and Developmental Disabilities. Peer support is an intervention that must be prescribed on the individual recovery or resiliency plan. It must be authorized by the Administrative Services Organization, and an individual can also receive peer support without it being prescribed through a state-funded or peer-run organization. So just to kind of give how do you access a peer support service, I also want to be clear that it's not something you can just go get, if you will, but it is a referred service that is billable. So I am now, and I've talked a lot, going to hand the reins over to Bonnie Ray, who is a certified peer specialist parent with a unique experience of not only receiving peer support services, but serving in a capacity of a CPSP within a community service board previously, or local mental health agency, that can give her perspective and experience on peer support. So I'm going to hand the reins over to you, Bonnie.
Well, thank you very much, Lakidra. Um, so peer support for me is vital whenever you're dealing with uh, mental health, behavioral health, and substance abuse. There has to be some type of peer support. As somebody who's received peer support and has also provided peer support, I kind of came up with a list of the things that I feel peer support does that helps families. First of all, it's strength based. A lot of times when you're dealing with outside agencies, whether it be children's services or the schools or juvenile justice, they're looking at what's going wrong. They're looking at what needs to change. With peer support, we're looking at what are the family's strengths, and then we're building on that. Um, I love the fact that peer support offers that outside support without necessarily having to have agency involvement from the outside agencies I mentioned earlier. Um, you can have peer support and not have those agencies and still benefit. Um, the biggest thing for me, though, is when I was receiving peer support services, I was at a time with my child that I couldn't that there was any hope of him getting better. Um, the peer support specialist that I had working with my family showed me that there was hope, even though I couldn't see it. And I'm proud to say that my child is now fixing to graduate from high school next week with straight A's, and doing absolutely amazing. I really feel like if it hadn't have been for the peer support we received, I don't think the outcome would have been what it is now. Peer supports also help locate local resources when there's extra help needed. Excuse me. Whether it's needing extra help with food or whether it's needing extra help, finding a right, talking with a therapist to find the right medication, or whether it's helping talk with the school about getting an individualized education plan. They can help locate resources for those things when it's needed. One of the biggest things for me, again, was the fact that it showed that I wasn't alone in struggling with the things that I was struggling with my child. There were people that were going through it and that had been through it and came through on the other side. And just that knowledge that we weren't alone went a long way in helping me be determined to keep moving forward. One of the things that I've done with some of the families that I've served and was done with my family as well is whenever there was a goal reached or a milestone reached, there was a big celebration. Like we made a big deal out of it. And that helped because it helped solidify, I guess, for lack of a better term, that progress was being made, and we could look back and see where the progress was being made. Um, One of my biggest challenges when I first started receiving peer support is I could open my mouth and tell people what I needed, but I couldn't advocate in a way where people would listen. And with peer support, they showed us that we could. Um, they taught us, they taught me how to advocate in a way that people would listen to what I was saying. Um, they were able to help set goals and create steps to uh, reach those goals. Um, and one of the things for me is, and it really showed how much peer support is about the family, is they supported our decisions in our family, even if they didn't necessarily agree with them. Um, that meant a lot. And then it took peer support takes a multidisciplinary approach to serving the families because you don't just have one person serving the families. It's a group of people that are all coming together, and that made a big difference. Lakidra, can we get the next slide, hon? Thank you. All right. Working both, both working in in the peer support role and receiving it. I also noticed some things where there could be some changes to make it even better. Georgia does a great job with their peer support, but as always, it's a learning curve, and there's always room for growth. Navigation timelines and being able to be timely, and being able to understand the eligibility of Medicaid and private insurance. One of the things that I discovered is when my son had one type of Medicaid, certain services were covered, but then when they switched him over to a different type of Medicaid, those services were no longer covered. So being able to understand the difference in that. Um, Also, um, making sure that peer support is known about, widespread sharing in our communities about peer support services, what it is, how to go about accessing it, and the different trainings that are available, not just for the peer support workforce, but also for the families that they may not know about or have access to. Because even now, I'm still learning about different trainings that as a parent I can take, such as mental health first aid, that I didn't know were even available to me. But I also feel like we need to fill in the service gaps. Um, we need appropriate and equitable, um, and competitive wages for our mental and behavioral health workforce. Um, and that's, I don't want to get into all the details of that, but it's something that needs to be looked at if we want to maintain and build our peer support workforce. But we also need to think outside the box when it comes to making sure that services and treatments are available throughout the state, including in the rural areas where maybe transportation isn't available. And then increasing family involvement and engagement in the treatment planning. One of the things that I loved was that I was included in planning the treatment plan for my family. Um, but in order to do that, you've got to build trust with the families. And sometimes that takes a long time. And I think if we can work on those specific areas, then I think Georgia's system of care and peer support is going to be well worth everything we're putting into it. And with that, I'm going to turn it back over to Lakidra.
Thank you so much, Bonnie. I hope you see the love that you're getting
I
um,
did.
from the participants and the comments in the chat as well. And I'm just going to hand it on. I'm going to hand it on over to Tandy Way Harris to talk even more. As we talk about the peer support and what's established, how it's developed, continuing to evolve, and talk about our communities of practice.
Yes, so this is just really exciting. Once again, my name is Tandy Way Harris. I'm excited to be here. I work for DBHDD, following by Lakeisha. I don't want to say the name because it's very lengthy, but that's where my place of employment is, and I'm a certified peer specialist for parents. And if you can go to the next slide, please. So, what we have done to support the parent and youth certified peer specialist workforce is in Georgia is that DBHDD initiated a community of practice. And again, it's specifically for parent and youth CPSs who are employed by system of care providers. And for those who are unaware what a community of practice is, I'm just going to read the definitions. Communities of practice are groups of people who share a concern or a passion for something they do and learn how to do it better as they interact regularly. Next slide. So as we said that it was initiated by DBHDD, and it's for parent and youth CPSs, and we meet virtually and we meet in person. If you can go to the next slide, please. So with our community of practice, though DBHDD initiated it, it's very similar to the principles of peer support. As far as with peer support, it is around the family, and the family are the decision makers. So though DBHDD initiated it, the members, the participants are helping to develop it. What we do is we learn collaboratively. It's collaborative learning. So we do that by sharing our stories, and which also establishes a connection with one another there in the membership. And then also we share strategies that have worked. What we did at when we started to move this forward is I reached out to the CPSPs and CPSYs who were working for DBHDD system of care providers, and I asked them, hey, listen, what is working for you? And they would share what was working. And then what barriers do you have? We didn't want to act like they didn't exist. So we wanted to identify them. And what we did then is during our meetings, sometimes we will start brainstorming on ways to address those barriers while remaining solution focused, because our environment is very, very, as Bonnie shared, strength based. A lot of the I want to what's word a lot of the things that we use in peer support, we've applied here. A lot of the principles of peer support, like connection, establishing a connection through our stories. We do that in our communities of practice. So we kept that model because we know it works. Once we identify those barriers, we also ask the peers, okay, so what training would you like to have? We want to know what works for you. We didn't want to go and just say, hey, listen, we're starting this community of practice and you need to learn X, Y, and Z. No, what do you want to learn? What barriers are you having? What do you want to learn about? And then what we do is we bring the experts in the behavioral health field to give them that training to build their CPS skills, because that was part of the vision. We wanted to build skills and establish connection. And so we found something that works. And it works because, again, the members, the participants, they are developing the community of practice as it grows, even to the point of helping us, create a mission statement. We asked them what mission statement works. We went to them. They told us what was important. One was created. Then we actually created two. They voted on which one that they liked, because we want them to know that it is about them. It is about their time where they can learn and they can receive what they need to be strengthened as they go out and provide support to other families and youth. So the trainings cover topics that members have requested. And again, I want to go back to the connection. That is so important. And that's what a lot of the participants really, really appreciate. They even put in that they wanted it in the mission statement, that they wanted connection. So they connect with one another, and the environment is psychologically safe. And so what that means is they can share any strategy, they can share any concern, they can make a statement without the fear of being judged and without the fear of being penalized. And they really, really appreciate that. So it is a community of belonging. I just want to just name just a few of the training that we have offered based upon the request of the members. We've done training on self-care. We've done training on establishing a connection, de-escalating a potential crisis. Another big one we did was how a CPSP and a CPSY can work together as a team to support a family, so that they're providing support too. And the list goes on. And what we do is to make sure that we are nailing it, for a lack of a better word. I don't know if that's the right term to use, but that we're doing what we're called to do, what we want to do, which is make sure that they're getting equipped with the skills that they need. Is we ask them, how do you feel it's going? We do a survey after every meeting. We've had a SWOT analysis for strengths, weaknesses, opportunities, and threats. Had them participate in that. We did a focus group because we still want to get feedback. We still want to know what is working, so that they are getting exactly what they are asking for. And we want to support them in the work that they do, because we really, really believe in lived experience in Georgia. And that'll be all. Back to you, Lakedra.
Thank you so much, Tandy Way. And I'm actually going to I'm going to come back to this one, because I think where you ended takes us to want to engage with you all. I know we don't have a lot of time left, but one component I think both of y'all may have mentioned that's very important in the peer support training is being able to answer, what is your why? Why do you do this work? What keeps you waking up and starting again and doing this work? So I'm scared of this chat because they go so quickly, but I'm going to ask you to put in the chat, what is your why? What keeps you going in this work? What is motivating you? What keeps you motivated? You can just put it in the chat. Okay, I'm already seeing passion pop up a lot. Passion for the children, passion for the individuals, and to help others. Hope. I know hope was mentioned a lot today. Supporting others and seeing their confidence grow. Yeah, so I think that's something. And while I highlighted that that's something that is used in the peer support certified peer specialist training, I think that's something we all need to ask ourselves, or continue to ask ourselves on a regular basis. What's your why? Excuse me. Why are we doing this? Bringing us back to the remembrance of what's at the root of the work that we do. Even with our statewide meetings, we often start with a speaker from the Respect Institute, which is an organization of individuals that have lived experience. So we start off with a lived experience speaker in this work. And while you all hopefully continue to answer that question, I'm going to turn it over to Tandy Way and Bonnie to ask, what is that you want families to know, or what is it that you wish you would have known? And I know you mentioned some of it, but what would you want families to know in your experience in navigating this work? And I'll give it to Bonnie first.
I think for me, the biggest thing that I want families to know is that they're not alone, and that there is hope out there and resources out there.
I want to just, I would say everything that Bonnie just said, that want parents to know that and youth to know that they are not alone, and that there is support out there. There is hope. Recovery is real. It is a process. However, it is real, and that they're important, and they deserve to be treated with respect and kindness. And I would want parents to be reminded all the time that they are the experts. Lakedra, you're on mute.
Can you hear me now? I had a whole conversation, sorry. But I was thanking you all for sharing, and I know we're getting close to time. But just reminding that there's resources and people who truly care being part of the journey of rediscovery. And you all can continue to add. And I just want to highlight, and I'll have to hand it back over to Dr. Kelly soon, but just some of our lessons learned in this process. Again, we've named some of them, but more awareness and education about connection to children's mental and behavioral health systems, and awareness of community level support, peer support, high fidelity wraparound, and other services. You don't know what you don't know. So being intentional about what's available and making that connection, having a strengths-based approach and not focusing on deficits. That's when I really like to highlight. I think even when we ask a question in those local service coordinated meetings, what are the family strengths? What's going well? Sometimes there's a pause because sometimes you're used to always saying what isn't going right, what's going wrong, and not to um, undermine the importance of acknowledging what isn't going well, but having that strengths-based approach, I think is very helpful and important. The importance of early intervention, whether that's in the service delivery or in the age. In Georgia, where there's a lot of great work being done around infant and early childhood mental health, and access in the schools and other areas, more non-traditional communities or areas, and also data collection and tracking, which I know that's sometimes a scary word, but the importance of being able to track what's going well, what isn't going well, where things are happening, and where there's gaps in services. So that's something that we're looking closely at as we move along as well. And we've been doing some pilots around that as well. And with that, just want to say thank you. And here's our contact information. I think it's also available in this AirMeet world. But thank you all for your time, and I'm going to hand the reins back over to Dr. Kelly.
Thank you so much, Lakedra and team. There was just 2 questions in the Q&A that were not answered, and so I'm just going to see if there's anything quickly we can say to these. The first one was, is there any particular youth peer-to-peer support curriculum that you all might be able to suggest?
I'll give that to Tandy Way. I know that she's a part of the curriculum that's used. I don't know if it's built in-house or if it's a specific one, but go ahead.
So what we have right now for youth are in the state of Georgia is for a youth who is between the ages of 18 and 26 to be certified to become a CPSY. That is what we have right now for training. That's the training that is offered to become a CPSY. How that looks is through Lakedra's presentation. There it is. They go through. It gets recommended. There it is Medicaid billable. I'm a little unclear. I'm unsure if you're saying independent of the youth CPSY training, or is there any just because the CPSYs will work with the youth and find out what their goals are, and work with them and support them, through their journey. I haven't heard of any. They will use the training that they receive from their certification to help support the youth that they're serving, if that makes sense. I haven't heard any direct, just independent of that training out there to provide peer support to. I hope that answers the question.
Thank you so much, Tandy Way. So we are just at about time. They have provided their contact information to you all. So if there's any additional questions that you all have, I'm sure they'll take your email or something, from you all. We want to thank you all for your time. I want to thank our presenters for sharing their time, their experience, and their expertise today. We really appreciate this just important information and how you all engage families. Our next session will start in 30 minutes. So we have a break from 12 Eastern to 12:30. And then we will come back for our keynote presentation at 12:30 with Vanessa Williams. And Vanessa Williams will illuminate the evolving strategies, societal shifts, and personal growth that have shaped the journey through crisis services. So we invite you all to join us for that session. Again, if you all can just put some emojis up to show some love to Tandy Way, Lakedra, and Bonnie for this information. And again, if you have questions that were not able to be addressed, please do reach out to them. Thank you all for your time, and we'll see you back at 12:30.
Take care, everyone.
Bye.